Hello, I'm Natasha Kavanagh for Dubai Life TV. I'm joined with Dr. Jamie Abdennadher, who is a primary care physician here at the American Hospital. Dr. Abdennadher, tell me a bit about you.
Well, thank you very much for welcoming me on the show. In terms of a little bit about me, I'm a British doctor, obviously working here in Dubai as a primary care physician.
What have you found is the most common ailment from people who are coming in to visit you here?
Well, that's very interesting that you say that. And coming from the UK, which is a much colder climate, I had thought that I would be leaving behind all the coughs and colds and bugs in that cold weather. But I've been very surprised coming to Dubai with this hot climate. It's still a huge issue. Predominant presentation I've had from patients has been upper respiratory tract infections, or otherwise known as the common cold. So I've seen a lot of that.
And can you recommend anything for the prevention of cold and flu?
Well, I mean, I think the common cold itself it's a bit of a it's a confusing sort of an illness for a lot of people because it presents with a lot of different symptoms. We will have patients who predominantly come in with the sore throat, the runny nose, the headache, but of course the common cold viruses also produce the nausea and vomiting and diarrhea. So there's a huge spectrum of symptoms that it can present with. The predominant things coming out in terms of protecting yourself from the common cold are something definitely to do with diet. The other thing is exercise, which is quite an interesting link. So there's definitely evidence out there to say that if you are somebody who's active and you're exercising enough times during the week, you seem to acquire less colds than somebody who is inactive. So that's definitely something that we could all hope to kind of engage in terms of protecting ourselves from the common cold. The other area, of course, which is I think very relevant to Dubai, is stress. That people who are under stress acquire more colds during the course of the year.
What do you have that comes into you quite regularly, and what sort of means do you have for diagnosis here in the hospital?
In terms of cases that I've seen so far, I think we have quite a few respiratory conditions like asthma, but I probably would like to mention today some of the cases that I've seen of newly diagnosed diabetes.
Then finally, what advice would you give to the residents here in Dubai for their general well-being?
I think this is an excellent question. I really, as a primary care physician, it's at the absolute heart of what we're here for. We would much rather prevent illness than treat it once it happens. So in terms of keeping healthy, I think the big things, if there's one thing I could say to people, is if you can this year, if you are a smoker, please stop. So stopping smoking will increase your health benefits multiple times over anything else that you might want to try doing this year. The other things, of course, are exercise, which we mentioned before, and as a rough guide, you want to be looking at about 30 minutes of pretty vigorous activity, coming out of breath, a little bit sweaty with that exercise, about 3 to 4 times a week. Equally, weight is an issue, so if you think you might be overweight, in terms of being a little bit having a high weight for your height, then losing a little bit of weight is going to help as well with things like improving blood pressure and again staying healthy. And of course the final thing, which is a big temptation in here in Dubai, is food. And I think I've noticed that myself. You have to be very focused to keep your diet healthy here. So that's sticking to 5 pieces of fruit and veg during the day.
Well, thank you so much, Dr. Abdennadher. It's been a pleasure to come in here and meet you today.
Thank you very much.
Thanks for talking with us.
Thank you.